Leukemia research now. Leukemia is one of the many cancer types that have been known for a long time to cause far-reaching effects on the patient. Leukemia occurs in the human body as a cancer of the blood whereby it affects the blood and bone marrow. This medical condition is usually characterized by an unusual multiplication of immature white cells in the blood. This condition is medically referred to as blasts. Leukemia research has proved that this cancer of the blood is a broad disease that incorporates several cancer-related diseases. However, these cancer diseases only affect the blood, its components and the bone marrow. In addition to affecting the blood and bone marrow, leukemia equally affects the lymphoid systems. The presence of leukemia in the blood hinders the effective supply of oxygen and food nutrients throughout the body. In leukemia research done in 2000 in the USA, it was approximated that about 256,000 people had leukemia in their bloodstreams. From the 256,000 people who had leukemia, at least 209,000 of them died from leukemia-related illness. The research went ahead to confirm that adults stand a high chance of being affected by leukemia at 91%. Leukemia classification. Leukemia research conducted by medical officers in the UK in conjunction with those from the USA has provided the basis of leukemia classification. This classification is based on the effects of leukemia in a patient. Generally, leukemia is a deadly disease that is known to kill within 24 hours after it reaches its climax and is not attended to in the right way. Acute leukemia. This is a fairly severe case of leukemia that is characterized by an overwhelming increase in immature blood cells. The immature cells then crowd together in the bone marrow, thereby hindering the bone marrow's ability to produce healthy cells. Leukemia research on this type of leukemia indicates that this leukemia is mainly common in children as opposed to adults. This type of leukemia is treatable, especially if identified in its early stages of attack in the bloodstream. Leukemia research done by students of the University of Florida, USA, indicates that this leukemia is present in at least 3 kids of every 5 kids diagnosed with leukemia. Chronic leukemia. Leukemia research on chronic leukemia provides that this type of illness is characterized by excessive production of abnormal but relatively mature white blood cells. This type of leukemia takes quite a lot of time before it develops into full-blown chronic leukemia. It can take months and even years before the disease is positively identified in the patient. Detailed leukemia research done by scientists has confirmed that unlike its acute counterpart, this type of leukemia does not require any emergency attention. As such, doctors closely monitor the progress of the chronic leukemia before deciding on the best treatment method to apply. Chronic leukemia is mainly evident in elderly people as opposed to the younger generation. Time allocation in chronic leukemia treatment is used so that doctors are able to ensure that they are able to apply the most effective ammonia treatment therapy. In addition to this classification, detailed leukemia research has proved that it is possible to classify leukemia according to the blood cells that a specific leukemia affects. Under this classification, there is lymphoblastic lymphocytic leukemia and myeloid myelogenous leukemia. Signs and symptoms of leukemia. Leukemia research done in the USA on patients suffering from the illness has proved that there exist a lot of similarities in people affected by leukemia. All the patients who were used in order to write a conclusive detailed report had few common signs and symptoms. The first symptom concluded from leukemia research is persistent headaches in the patients. Another symptom that was identified from the research is bleeding, especially through the nasal opening and the gums. Further leukemia research shows that the bleeding is usually profuse and can lead to death if not well taken care of. This is commonly the situation in acute leukemia, whereby most patients die from excessive bleeding. Blood spots were also noted in urine samples provided by the patients. Other patients complained of continued bone pains whose causes are unknown. A leukemia research done on patients suffering from leukemia in the United Kingdom established that in most cases, leukemia infection results because of frequent bacterial infections of the patients. This is due to the fact that after the attack of leukemia, the body's general immunity is destroyed. This leads to the inability of the body to be able to fight germs. According to leukemia research, there is a very high possibility that most of the deaths that occur in leukemia patients are as a result of bacterial attacks in their body. This, coupled with the body's weak immunity, makes it possible for the body to succumb to the terminal illnesses of leukemia and hence the patient. This factor explains the cause of sudden deaths in acute leukemia patients. Treatment options for leukemia. Detailed leukemia research on the causes and the available treatment options of leukemia has provided several treatment options applicable in leukemia. These treatment options include chemotherapy. This treatment option is used to kill cancerous cells in the blood that causes leukemia. This treatment option is, however, only applicable in the initial stages of the disease. Leukemia research on the best treatment options for advanced stages provides for surgery and bone marrow transplant. The latter treatment option is, however, very expensive and fairly risky as compared to other leukemia treatment options available. Surgery therefore edges out as the best treatment option for curing advanced leukemia cases. Apart from surgery, bone marrow transplants and chemotherapy, there are also other treatment options as provided in the leukemia research done by students of the University of Illinois in 2002. These treatment options include radiation therapy, biological therapy and other innovative treatments. The latter treatment options vary from one patient to the other in respect to the extent of damage to their bodies by the leukemia cancer in their bloodstream. Leukemia research conducted by World Health Organization, WHO in mid-2003, just when the disease was at its peak, provides that leukemia is preventable. Prevention of leukemia, according to the research, is achieved by maintaining a healthy and well-balanced diet. The diet of choice should also be inclusive of blood-cleaning foods and fruits. These foods help to lower toxicity in the blood and thus it is easy to reduce the chances of the disease occurring.